Hello, everybody. I'm Sarah McKenzie. I'm one of the respiratory therapists working in Breathe Easy in Red Deer. And today we are going to talk about inhaler technique. So there are lots of different devices on the market these days, which is great because we have lots of options to try in case something doesn't work with you or you have side effects. It also makes it a little bit difficult to know how to take your puffers. So it's really, really important that you have a good grasp on the proper technique, care, and maintenance of your puffers because you'll get the best bang for your buck. Puffers are expensive. If you're going to take it, you need to make sure that it is working. And also you want to make sure that when you take it, the medication is going down into the lungs where it needs to be. Okay? So today we're going to talk about the importance of correct inhaler technique, including the proper use and care of your inhaler devices. So why is it important to have proper inhaler technique? Well, I already told you that answer. Because you want to make sure when you take the puffer, it's getting down into the lungs where it needs to be and doing its job to improve your breathing. Here's that cross section of the entire distance that puffer needs to travel all the way down into the smallest part of your lungs where it is absorbed and begins to work. There are lots of places here where that puff can get caught up, and we'll talk about that here in a little bit. Having the correct technique, the correct breath speed, and the correct breath hold all come into play to ensure that that puff makes it down where it needs to go. So let's talk about MDIs first. Anything that is shaped like this is an MDI, which stands for a meter-dosed inhaler. There are several different components of this puffer. This is the mouthpiece here. The actual canister comes out, and this is where the medication is held. This is also where what's called a propellant is held. The propellant helps the medication to shoot out. So it's really important that you shake your puffer before you take each puff because the propellant and the medication do not stay mixed. In fact, the propellant settles and the medication sits on top, kind of like oil and vinegar. So if you never shake your puffer, and I have seen this a couple times, what can happen is you feel like there's still something in there, but nothing shoots out. So what's happened is you've shot out all the propellant and the medication is in here, but you have no way to get it out. So you have to go and get a new puffer at that point. Okay, so the way to take this, like I said, you start with shaking. You want to breathe out away from the device. I'll explain why that's important. Generally speaking, the way that I do puffer teaching is to make it the easiest across all of your puffers. Okay, so if we get in a habit of breathing away before we breathe into the puffer, you will never disrupt the puff, and that comes into play when we talk about a dry powder inhaler. So we'll talk about those in a little bit. So you want to breathe out. If you're not using a spacer, which we will talk about next, you have to correctly time initiating the breath and pressing down on the canister. This is very difficult to do. And in fact, most of that puff lands in the back of your throat because the speed in which the medication and the propellant shoot out is likely going to be faster than your breath in. I'll hold the device in front of me and imagine this is the back of your throat. See how fast that came out? So even if you have a good breath in before you press the canister, you're still going to get most of that deposition on the back of your throat. In fact, with a perfect breath, you get only about 10% of the dose. So that being said, if you're out and about, you don't have your spacer with you, you can still take this. Keep in mind, you're only getting 10% of the dose. So breathe out. Lips and teeth on here. Breathe in. Hold for 10 seconds or as long as you can. The breath hold is really important because that allows the medication to be absorbed into the lungs. If you were to breathe out right away, most of that medication comes right back out in your exhaled air. So the breath hold is important. 10 seconds if you can, or as long as you feel you can. Here's something to think about. If you are too short of breath to do a breath hold, it might be more valuable to do about a minute of breathing techniques before attempting to take your Ventolin. Because after a minute or so of breathing techniques, your shortness of breath may have resolved to the point where you don't need Ventolin anymore. So you have now resolved your shortness of breath using the powerful tool of your breath without taking additional medication. Yes, that's the point, right? So when I took that puff, I really tasted it at the back of my throat. Even though I started breathing in before I pushed this down, the speed at which it came out hit the back of my throat, okay? Storing. You always want to make sure you have the cap on because things can get caught in here and we don't want to breathe them in. I had a guy, I was doing puffer teaching, and he took his puff and then he went and pulled out a big piece of pocket lint. He's lucky he didn't inhale that into his lungs. That could have wreaked havoc. I had another guy dump a penny out of there. The other day, I didn't have my cap on. This was in my purse, and I had an earplug stuck in there. So generally speaking, keep your cap on if you're not storing this like so, okay? The other thing to note about MDIs is that they cannot maintain the medication in there in extreme cold or extreme hot. So you cannot leave this in your vehicle in -40. Once this freezes, we can't guarantee that you're going to get the full dose, okay? You also can't leave this in your vehicle in +40. The canister can explode. I've seen this once. It completely tore up the center console of somebody's vehicle when it exploded. So not a good scenario. So even though we like to have our bedside table Ventolin, our pocket Ventolin, our purse Ventolin, and our car Ventolin, don't keep this in the vehicle with extreme temperatures, okay? In fact, keep it out of direct sunlight and in a cool place is the best way to store this, okay? How do you tell if this is empty? We used to do the water test. You take the canister out, you dump it in water, and depending on the angle that it sits at, it's either full or empty. This is incredibly subjective. We also don't always have a bowl of water around us when we need to take our Ventolin. So here are a couple easy ways to check. A, does something come out when you press it? That's a good indication that there's still something in there. If you remove the canister, if you shake it back and forth, can you feel liquid moving back and forth in your fingertips? If you have any numbness or arthritis, you may not be able to feel. Another way is give it a shake by your ear. Can you hear liquid shaking back and forth? If you have any hearing issues, you may not hear this. So if nothing comes out when you spray, you can't feel or hear liquid, you can assume that that puffer is empty. Go get a refill, okay? That is MDIs. Let me know if you have any questions about MDIs. So next we'll talk about MDI with spacer. This is the gold standard way to take MDIs. Hopefully after I explain this, it will be incredibly obvious. So this way, you get about 10% of the dose because 90% of the dose hits the back of your throat. With good technique, you get 90% of the dose with an MDI and spacer. 10%, 90%, that's a huge difference. Huge difference. So that's why it's recommended that whenever possible, you always use your MDI with spacer because you are getting more of the dose, way, way more. So this also allows you not to have to time your breath with the push of the canister. This makes it easier to take and easier to take well. In fact, the spacer will hold the puff for up to 10 full seconds. This gives you the opportunity to push the puff down, get your breath ready so that you can take a nice, full, slow, deep breath in to breath hold. Okay, so it looks like this. We always shake in between every puff. Some people shake it all together. You can take it out and shake it. You can take the canister out and shake it. Doesn't matter, just shake it. Push this down. Now the dose is ready. We can get our breath ready. So take a breath out away from the device. Lips and teeth on here. And hold for 10. Okay. Slow breath with the MDIs because of the liquid that's in here. If you have too fast of a breath, you can shear the liquid particles, which can affect the dose that you get. So a nice slow breath. What happens if I hear this sound? Hopefully you said slow your breath down. Every spacer comes with a whistle mechanism that gives you an indication if your breath is too fast. So some puffers are more sensitive to activating the whistle. I know my Alvesco is very sensitive, more so than my Ventolin, but slow your breath down. Okay, so we start with empty lungs so that our next breath can be full and deep, nice and slow, and we breath hold to allow that medication to absorb. Okay. We used to think that a little bit of cloudiness in this spacer meant that we had to wash it right away. That's no longer the case. We know now that the cloudiness in here is propellant. So the propellant builds up on the inside of the spacer, which actually helps more propellant to stick to it so that our lungs are seeing primarily the medication. The propellant is not harmful, but whenever we can get just the medication, it's always the best. That being said, if you're looking in here and you're seeing cakiness, like there's layers to the propellant, or if you look in the mouthpiece and you can see little dots, white dots, that means that it is time to clean. It does build up to the point where it needs to be cleaned. This can come apart and warm, soapy dishwater, air dry fully before you use it again, okay? The mouthpiece will get lip gunk on it. Lip gunk contains bacteria. We do not want bacteria to sit on the mouthpiece. That can increase our risk of infection, especially since we're breathing the stuff in, right? A just wet, warm washcloth, wipe this often. You will get the most longevity out of your spacer if you take care of it that way, okay? Why do we get lips and teeth on here? Because you will get some of the puff on your teeth. So that will decrease the amount of medication that your lungs see. So same way with our pulmonary function test that we get lips and teeth on is so we have a good breath, right? All right, so that's MDI with spacer. Let me know if you have any questions about that. Respimat. So for any of these puffers, rather than take the time to bring up other videos on YouTube, what I will do is I will send you the links to the YouTube videos for these puffers, and you can watch them and let me know if you have any questions. Basically, back in the day, the only way that we could take Spiriva was with a hand inhaler, and we'll talk about that here in a little bit, but it was a dry powder inhaler, which meant you needed a fast, quick breath. Depending on the severity of your lung disease, you might not be able to produce a fast enough breath to take this puffer. So it was not only limiting because of the breath it required, but as we will learn here in a little bit, the device itself is very limiting. So when Respimat came out, now there was a way that you could take Spiriva without having a fast breath, which is super great. There's a couple other puffers or medication types that come in Respimat, Combivent, Inspiolto. There is a little bit of a technique to priming this device. If you are on a Respimat, or if your respirologist or doctor changes you to a Respimat, get your pharmacist to sit down and explain this to you so you have a good working knowledge of how to operate this puffer, okay? So I'll send you the video with all of the details. Discus. So this purple one specifically held Advair, and we learned that that is both corticosteroid and a long-acting bronchodilator. Discus, this is now a dry powder inhaler. So I like to think of it like a block of chalk sitting in the puffer. When we prime the device and get the dose ready, it's shaving the dose off that block of chalk and holding it in a cup, okay? So for this guy, first we need to open the device and expose the mouthpiece. So we do that by this little handle here. We open it until it clicks. Now you can see the mouthpiece right here. But with this device specifically, we need an additional step to prime the dose. So see this little handle here? We push it down until it clicks. Now this dose is primed. The powder is sitting in the cup. We can get our device, our breath ready to take the puff. This is where it's really important that we do not breathe out into here because it will disrupt the dose. That powder will be lost and we will need to prime another dose. So we don't want to waste doses. Don't breathe out into here. You need to hold this device upright so that it doesn't affect the dose as well. So we breathe out. With dry powder inhalers, it's a fast, quick, deep breath to bring that powder up into our inhaled air. And then we breath hold just the same to allow that medication to absorb. So it looks like this. Hold for 10 if you can. Let that go. So with dry powder inhalers, most of these guys contain a corticosteroid. So it's really important that you rinse your mouth out after, get that medication out of your mouth so that you're not at risk of getting thrush. A quick swish and either a swallow or a spit will do the trick. After you're done taking this puff, you can close the whole unit all together, and now it's ready to store. Keep this out of heat, keep this out of cold, in a cupboard, in a cool, dry place away from sunlight. Okay, so this is the Discus. This was the gold standard DPI for Advair for a very long time. And then there is another device that we'll talk about next that helped to solve some of the issues with this device. So opening this device was quite difficult, plus the additional step of priming it. We solved that with the Ellipta. So when the Ellipta came out, this was a big deal because not only is it easier to take, but most of the medications in here are only once a day. So now your puffer regimen is streamlined and it's easier to take. So with this guy, now when you open the device, it also primes the dose. The cap for the mouthpiece is a lot wider, which allows you to get more surface area on it. Most people find it's easier to open. So you pull it open like this. When you hear a click, now the puff is ready to go. So it's really important you don't breathe out into here. You get your breath ready just the same, and it's a fast, rapid breath because this is a dry powder inhaler. So and hold for 10. Rinse your mouth out afterwards. When the puff is done, close the device. Now it's ready to store. Does this puffer have anything left in it? If you said no, you are correct. So this has most dry powder inhalers have a dose counter. This one specifically, once it's less than 10, it starts to show red. Once it's fully red, this puffer is empty. It's really important that we pay attention to the dose counter because it will continue to click, right? So if you're not paying attention, you get that click, oh, the dose is primed, you take the puff, but you're not getting anything, right? So we always pay attention to this. When it's less than 10, it's ready to get a new prescription filled. Okay? And always rinse your mouth out after taking it. So what would happen if you prime the dose and, oh, I just dropped my puffer. Oh no. You would have to close it and prime another dose. We cannot guarantee that that dose is still in the cup ready to go. So unfortunately, you've just wasted a dose. It really sucks when that happens, but we just need to do it again, get our breath ready, take a breath in. What about if we take a breath and we're like, oh man, I thought I emptied, but it wasn't a very good breath. I don't know if I got the whole dose. Without closing this, you can take an additional breath and get the rest of that dose. Sometimes that happens, right? We prepare, but it doesn't always work out. So without closing it, so there might be a partial dose in here, set your breath up again and fast, rapid breath. And hold for 10, okay? Some people prefer to do a second breath without double dosing, so you're keeping the cap open 2 breaths. That's okay. If you know that you start with an empty breath and you take a big fast breath in, you can almost guarantee that you've got the whole dose, so you don't need to worry about that, okay? So that's the Ellipta. HandiHaler, this is the one I was talking about for Spiriva. So for years and years and years, decades even, this was the only way that you could get Spiriva, which was a long-acting anticholinergic, kind of a gold standard treatment for COPD. So this device is very not user-friendly, and I'll show you why in a bit. So each pill comes blister packed. So this is challenge number 1. Can you open blister packs? Challenge number 2, we open this up to expose the mouthpiece. We open up the mouthpiece to expose where the pill sits. I've got one sitting in here. So once you've got the pill out of the blister pack, can you fit it vertically into this tiny hole? Not always easy. Once you have the pill in there, you close the mouthpiece. Then challenge number 3 is, can you produce enough force to puncture that pill? So you push this in and release. We've had people that have been pushing this down on tables, getting their partner to push on it, because there's a lot of resistance. It's not super easy. So then the 4th obstacle is, can you produce enough force to get the dry powder out of the pill? So this is a dry powder inhaler. You set your breath up the same as other dry powder inhalers. Breathe out. And then it's a fast breath in. As you breathe in, you'll hear that pill rattling. And once you're done, you can pour that pill out and give it a little shake in your hand. If powder comes out, your breath wasn't good enough. So there were a lot of people, for all of those reasons, that just couldn't take this puffer. And at the time, this was the only thing that was available. So we're not seeing this prescribed as a new medication as much anymore, but we do still see this. If people have been on this guy forever, they like it, they have no issues. If it ain't broke, don't fix it, sort of thing. Okay. So this one is what's called a monotherapy. It's a long-acting anticholinergic. So do we need to rinse our mouth out after this? Technically, no. But as a general rule, to make sure that we're rinsing out our mouth when we should, I always rinse my mouth out after every single puffer I take. And it's a good habit to get in, because then you'll never forget. It's a lot to remember. We have enough to remember in our lives as it is. Giving your mouth a quick rinse after every puff, you'll make sure that you reduce your risk of thrush, okay? So that is the HandiHaler. BreezeHaler. This guy, this guy came and went as well, but some medications still come in this, and it's important to remember, especially if you're in the trial and error phase with your doctor or specialist. this might come into play if you're not tolerating other puffers. So it is similar to the HandiHaler, but there were a few changes. We're not seeing it prescribed as much anymore. It's really tiny. So this came out at a time when everything, like our cell phones were small, everything was small, and it doesn't work for a lot of people because of that reason. But you pull the cap off to expose the mouthpiece here. Then you open the mouthpiece like so. There's a pill that sits vertically. Oh, it just dumped it out. So this sits horizontally rather instead of vertically. Then you close the mouthpiece. There are two buttons that you push in to puncture the pill. There's less resistance, which meant it was easier to prime the dose. Then your breath is the same as any other dry powder inhaler. Breathe out. Fast, rapid breath in, breath hold for up to 10 seconds if you can. Okay. And then you want to dump that pill out, give it a little shake in your hand. If there's any powder that comes out, your breath wasn't fast enough, or maybe you need to take 2 breaths on the same pill. Okay. So that was the Breezhaler. Moving right on. And like I said, we're rifling through all of this, but if you have any questions, please reach out to me. Turbuhaler. So this is a dry powder inhaler or a DPI as well. The most common medication in here is Symbicort, which it has a long-acting bronchodilator, oxys, as well as a corticosteroid. So you twist it and pull the cap off to expose the mouthpiece. You have your dose counter right here as well. To prime the dose, you are twisting this until you meet resistance and then twisting it back until you hear a click. Now this dose has been shaved and is ready for you to breathe in. Don't want to breathe out into here just like any other dry powder inhaler. So get your breath ready. Lips and teeth on here. Fast, rapid breath in, followed by a breath hold up to 10 seconds. Okay. And just for your interest, Symbicort is the only combination puffer that you can also use as a rescue because of the oxys. It is a fast-acting and long-lasting bronchodilator. This is what's called an off-label prescription. So if you are on Symbicort as your controller medication, your respirologist may or may not have a conversation with you about adding this as a rescue. It's really important if you are using additional puffs, though, that your prescription allows you to get this filled more than once a month. So it usually is respirologist driven, but it can streamline the amount of puffers that you have, right? Take this, you don't need your spacer, one done, ready to go, all right? So that is the Turbuhaler. Twishaler. So Asthma-Nex is a common medication in the Twishaler. It's exactly the same as the Turbuhaler, so I'll go through this relatively quickly. You untwist it, pull the cap off to expose the mouthpiece. To prime the dose, you're twisting it until you hear a click this time, and back till you hear another click. Okay. Otherwise, the breath is exactly the same as any other dry powder inhaler. That is the Twishaler. Genuair 2-Dorza. The Genuair device, when this first hit the market, they did a really good job of marketing this to doctors, and we saw a lot of patients prescribe this, and then they were all taken off. And it'll be obvious as I explain this device. So you pull the cap off to expose the mouthpiece here. It's kind of nice that it's on the side and not the top. To prime the dose, you push this button down. Notice how the window turns to green. That means the dose is ready. There's a dose counter right above the window as well. Now I can get my breath ready. Here's where it gets tricky. You have to produce a certain amount of inspiratory force before a door will open and allow the medication to come out. So the first part of your breath is against resistance. If you have advanced lung disease, this can cause shortness of breath. And what we were seeing is that a lot of people could not produce enough force to drop that door and activate the device, which is why a lot of people ended up moving off of this device and onto a different device that they could take. I'm not sure if you'll be able to hear the click, but I'll show you kind of what it looks like. So you're holding for 10. Notice how the window is red now. So that dose has been released and there's no dose sitting in there. So when I practice this on my placebo device, I do notice quite a bit. I feel like I'm almost halfway through my breath before I hear the click and the door drops. So it's not the best. But that being said, I have come across some people that do use this and do like this. And again, it's another option, right? It's always good to have options. So that's the Genuair. In Hub Wixella, I do not have a placebo for this guy, but I will send you a link to the video. Basically, it's another dry powder inhaler that contains the same medications as Advair. As you can see here, this is where the mouthpiece is. So similar to the Genuair, it's located horizontally. So you open the device, the door drops down, and then you prime the device on the inside as well. Dry powder inhaler, so your breath is the same, followed by a breath hold. Fast, rapid breath. So that is the Wixella. So that was it for the puffer technique. What I hope that you get out of this is that MDI with spacer is the best way to take this. You can get a spacer at any pharmacy. If you've ever had to go into the hospital, they probably send you home with these. This is the best way to take this whenever possible. If you're heading out and about and all you have is this in your pocket, keep in mind, if you're short of breath, you will find probably more relief with breathing techniques first than you will with Ventolin as a first line. Okay? So something to keep in mind. This is a slow breath. Anything that has a canister with liquid in it is a slow breath. Anything that's a dry powder inhaler is a fast breath. After every puff that we take, we hold our breath for up to 10 seconds. If you are too short, I didn't mention this, if you are too short of breath to do a breath hold, have you done about a minute of breathing techniques? Try doing your diaphragmatic and pursed lip breathing for about a minute, maybe longer. And if at that point you still feel like things are closed up, there's a weight on your chest, you're wheezing, whatever else the case may be, then hopefully your breath has slowed to the point where you can do a breath hold. But know that you can take 4 to 5 breaths in and out per puff, and you will allow that medication to absorb over those 4 to 5 breaths. So it looks like this. So that was 4 breaths. Over the course of those 4 breaths, your lungs have enough contact time with that puff that it can be absorbed. This is how we give medication to kids, because it's really hard to coach kids to do a breath hold for 10 seconds, right? So you can take it this way. Just know that if you are too short of breath to do a breath hold, that breathing techniques will probably work better for you. Okay, some of you may have a spacer with a mask. Which one do you think is better? If you said the mouthpiece, you are correct. So there is a little bit of the puff that is lost in the mask. However, like with kids, when it's hard to coach them to put their lips and teeth and make a tight seal, having the mask allows them to get that puff. Additionally, for anybody who has cognitive impairment, for whatever reason, they can't, say you've had a stroke and you can't make a tight seal, the mask is helpful because it allows you to still take this medication, but making a seal with your lips and your teeth on the mouthpiece is the best way. Okay, so there are other ways, but if possible, this is the best way. I do hear about people that get sent home with spacers with masks when they are capable of making a seal. I don't know why they do that. Maybe when you got into the hospital, you were in a state where you couldn't make a seal, and so that's the one that they opened, right? But just know that this is the best way, okay? So all of that being said, How confident do you feel to use the proper technique for each of your inhalers? This is where taking your own health into your own hands comes in really handy. If you don't have a good grasp on your puffers, you need to reach out. Reach out to me, talk to your pharmacist, get them to explain it. If at any point you need to change to a different device, get them to explain it. Get them to sit down until you have a good grasp of how to take this. Being able to take your puffer properly is essential to your overall management. Knowing that that medication is getting down there and working, that'll help with your breathing, that will help decrease your risk of chest infection, improve your quality of life, all of those things. So super important. So the confidence and motivation scale here, give yourself a number. If you're still in the trial and error phase with your doctor or specialist, trialing different puffers, you're not quite sure which regimen you're going to land on, you might not be as confident, and that's okay. That just means that you need more support. If you've been on the same puffers for eons, you're totally confident you could do them in your sleep, maybe you're 10 out of 10 confident, and that's perfect. If we're looking at that requirements for graduation sheet, respiratory medications is on there. The goal is, at the end of this program, you feel confident enough with your puffer regimen, including how to take each puffer, what it does, how to properly care for them, that you can check that off. And I'll be asking everybody towards the end of the program, and we'll have a quick conversation about it. Okay? So to summarize, often inhalers are not used properly. Inhaled medications are best if delivered deeply into the lungs. That's where they're supposed to go, right? Not our mouth, not the back of our throat, not anywhere else in the world. Proper inhalation technique is essential for best treatment, and each participant will have the opportunity to review your inhaler technique with myself if you need support, okay? So now that you know, pay attention to your inhaler technique. Almost everybody can tweak at least one little part of your technique to make sure that you're increasing the deposition of that medication in your lungs. And you're welcome at any point from now until the end of the program to bring your inhalers with you to class. If you're virtual, to have them sitting beside you and let me know that you'd like to go over that, and we can go into a breakout room. And if you're in person, we will take a little bit of time, maybe while you're resting in between cardio, parts of your exercise, and we'll talk about them, okay? And that is it. Thank you so much for listening. I will get those other links sent to you along with this recording, and I hope that you learned something today.